What is obesity? Adiposity, also known as obesity, is the technical term for extreme overweight. Whether a person deviates from normal weight can be determined by the so-called body mass index, BMI. Overweight starts with a BMI of 25, obesity is considered to be a BMI of 30. In many cases, obesity can be attributed to incorrect nutritional habits, but various diseases also promote overweight. 3 stages of obesity. Obesity is divided into 3 stages: obesity grade 1, BMI from 30, obesity grade 2, BMI from 35, obesity grade 3, BMI over 40. What is meant by Adipositas permania? Adipositas permania is the highest degree of extreme overweight, i.e. grade 3 obesity, but it is also known as morbid obesity. The reason, such extreme overweight not only almost always leads to secondary diseases such as joint wear or even cancer, but in many cases it also significantly reduces life expectancy. Adipositas permania considerably restricts the quality of life of those affected. For example, it is often no longer possible to pursue one's profession because long periods of sitting or walking are impossible due to painful joints. In addition, those affected are often ashamed of being so obese and experience contempt in their environment. The consequence, they take refuge in their own homes. The isolation and the associated psychological stress often make the complaints even worse. Severe overweight is a growing problem, particularly in the industrialized nations. Over the last 40 years, the proportion of people suffering from obesity has risen significantly. Almost a quarter of all adults in Germany and around 15% of children and young people suffer from obesity. In other nations, underweight is more of a problem. By the way, obesity is not really considered a disease but a health disorder. It often leads to both physical and psychological secondary diseases and can considerably reduce the quality of life of those affected. You should know these secondary diseases. The possible consequences of a greatly increased body weight are often more dramatic than obesity itself. In most cases, the risk of these diseases is increased by severe overweight, diabetes type 2, high blood pressure, cardiovascular diseases, fat metabolism disorders, joint diseases, various cancers, fatty liver, dementia. What my fat distribution tells me about my health. In addition to the BMI, the distribution of fat plays a major role in obesity in terms of the risk of developing secondary diseases. Studies show that a high proportion of abdominal fat in particular increases the probability of developing secondary diseases. Whether you have too much abdominal fat can be determined by measuring your waist. For women, the waist should not be more than 88 cm in circumference, for men not more than 102 cm. Apple or pear. One also speaks of a fat distribution pattern. This determines wherein the body fat accumulates most. In the android fat distribution type, also known as apple type, the fat tends to accumulate on the abdomen. Mostly men are affected. This pattern of fat distribution with a high percentage of abdominal fat is the most favorable for secondary diseases of obesity. The second form is the gynecoid type, also known as the pear type, in which the fat cells settle mainly on the hips and thighs. This mostly affects women. The risk of typical secondary diseases of obesity is significantly lower with this fat distribution pattern.